Great. Well, welcome to my esteemed panelists. I'm so pleased to have you join me up here because I am not the expert on malaria in the region by any means. But Deepali, I know you work very closely in this area. Can you share with us just a broad brush overview of what Gabby's role is doing in the region when it comes to malaria?
Yeah,
and
so
I'm going to ask you to go on mute if you don't mind. Perfect. Deepali, take us away.
Yeah, so thanks for that. So I think on our side at GABI, we are really excited about having a new vaccine. Obviously, our focus at GABI is around vaccines, and we've never before had a vaccine for malaria. So this is an entirely new space for us at GABI as well, working around the vaccine. So we're really looking forward to kind of moving into this space. One of the sort of upcoming milestones around this, first of all, I think, is having approval from our board to kind of invest in this vaccine and develop a program around this. And that's actually coming up in the next couple of weeks. So if that passes through our board, and we're quite hopeful around this, then that would mean for us to start to purchase the vaccine for countries that experience malaria and where this vaccine would be really impactful, and help to get this into immunization programs in these countries.
So it sounds like the World Health Organization approval was one step, but it's not necessarily the exact green light. You have to go through the board still. And because this is the first ever vaccine you're working with, this is unprecedented water for you. Can you share a little bit about maybe why this is the first vaccine? What have been some of the barriers to this point?
Yeah, so I mean, this is not just the first vaccine against malaria, it's the first vaccine against a human parasite. And so there are other parasites that cause diseases in humans. And so parasites are a lot trickier than viruses, than bacteria, just because they are more complicated organisms. And so when you're trying to find what we call a target in the organism against which you develop the vaccine, it's a lot harder to do that on the parasites. And so malaria vaccines have been in development for 30, 40 years maybe. And this one in particular, the RTS-AS01 vaccine, I think 30, 35 years in the making. And so, yeah, it's been very it's been amazing to see this. And I always think this first step is always the hardest step. Once you've sort of unlocked a little bit what you're trying to do, the sort of next locks in kind of in the sequence, I think are a little bit easier to get to. So a little bit like putting a puzzle together. You get the first piece in, and you can kind of figure out, where do the next pieces go. So it's not, the amazing thing is not just having this vaccine, but any future vaccine that might come along is now going to be easier to get to.
You mentioned that this was 30, 35 years in the making. What do you see in terms of political will influencing the progress on the medicinal space over here? How does that shape investments or prioritization?
Yeah, I think malaria is a really difficult area in this regard, I think, because we've been living with it for so long as humans, and we've had so many efforts to try to reduce malaria burden and a lot of ups and downs in the space. And so I think, over the course of the 20th century, there were a lot of efforts. We saw a lot of progress in, countries in Europe, in the US, et cetera. That sort of went down a little bit, revitalized since 2000. We've seen incredible progress in Asia against malaria, with some countries now having fully eliminated malaria. And so that's been really great. And then what we've seen in the last 4 or 5 years is sort of a stalling of this progress, and a continued underfunding of malaria prevention. I would hope that with the vaccine, for example, we can sort of reinvigorate this fight against malaria with this new tool, in line with all of the other tools, and have this sort of kind of renewed kind of progress in all of the stakeholders. But I do think it's going to be really critical for governments and the private sector to kind of think about what are the investments that they want to make in this, because it's not going to be something, you have the tools, but you need to finance them. You need to finance the use of them. And I think that becomes really important.
Right. And Deepali, I know you have to step off. I do have one more question before you go, though. You mentioned the role of the private sector of financing. How does GABI play a unique space in this, in creating that ecosystem of collaboration? Can you share a little bit more about how your operations have been underpinning the progress here?
Yeah, so I think, GABI is a sort of, we're a pretty unique model around bringing together the private sector, the public sector, et cetera. And one of the things that we find we've had to do, and I think where we've succeeded really well, is starting to align things like some stakeholders have a higher risk appetite, for funding and trying new things, others a bit of a lower risk appetite. And so trying to align where those risk appetites come together and having us all feel comfortable with what we're trying to do. I think there are sort of, I'd say, two pieces of this that I think are really important and that we've done, I think, a really good job with GABI and the creation of GABI as a model. One is, for the private sector to invest, there has to be some indication that, for example, in the vaccine space, there will be a market for this vaccine. So you don't make a product and then just assume it gets used. It's not if you build it, they will come. You have to build the infrastructure and the system behind it.
As we've all seen.
Exactly. And so I think in this case, what GABI has done, I think, really well is we've pooled all of the sort of beneficiaries, recipients, the sort of demand side, and built a sort of predictable market for low and middle income countries to be recipients of vaccines. And then for the manufacturers, when they think about, should I invest in A or B, if they know that A is going to get used and that there is a sort of landing space for this product, then they're more likely to invest. And so I think bringing those two halves of the markets and the technology development and the program feasibility together, I think is something we've really succeeded at, and looking forward to kind of bringing that experience now into the malaria vaccine space as well.
Brilliant. Wonderful. All right. Well, Deepali, thank you so much for sharing that with us. I know we'll be hearing more from GABI's chairperson following this panel, so we'll close out with that. But thank you so much. Have a wonderful day. Dai, I'm so excited to bring you into this conversation. I know that you have been, as a Rotarian, really at the front lines of what certain island communities are doing in a malarial space, and this Finish the Fight work that the Global Fund is leading on. So if you don't mind sharing with us a bit about what Finish the Fight is, where it's going, and what you want to see happen in the next 12 to 18 months, I can't wait to have that shared out with our global audience. And just a reminder that you are on mute. Perfect.
Okay, thanks, and I hope you can hear me okay. I just want to mention about Rotarians in Australia have been working towards eliminating malaria in Papua New Guinea and the Solomon in the 1990s. In more recent times, we've actually engaged with Timor-Leste and Vanuatu with the support of the Global Fund, RAM in Papua New Guinea, of bed nets, and other essential programs to improve the lives of people affected by malaria. In PNG, for instance, over 13 million, including 1.3 million. The impact of intervention methods has been significant, but over the last few years, there's been a resurgence of malaria and COVID-19 cases. Most deaths from malaria occur in pregnant women and children under 5. And worldwide, as we all probably know, there are over 400,000 deaths per annum and 214 malaria. In 2019, the Global Fund identified a shortfall in funds for villages in the high country situated about 1,200 meters. And we're looking for partners for that work. The Global Fund then approached RAM, Rotarians Against Malaria in Australia. This is in fact an activity of Rotary Australia World Community Service. And unfortunately, Rotarians have a lot of acronym. Following discussions, following the need to cover other Pacific Island nations, the Solomon Islands, Timor-Leste, and Vanuatu were included in that particular campaign, and an aspirational target of raising $12 million US. Now, following that formal agreement, and over a period of 12 months from then, planning, branding, asset identification, and evaluation to finish the fight. And the platform was effectively launched at the beginning of July this year with activation of our website. Our drive is to stop a child dying from malaria and every human action together to get the Western Pacific Rim World Health Organization 2030, if not sooner. And let's face it, 2030 is not far away, and much work is needed to be done. The opportunity of partnering with the Global Fund, which is recognizing work on malaria in this Western Pacific Rim, and working with advocacy partners for major changes the socio-economic framework of communities in developing countries. Now, we've created a team of volunteer Rotarians and engaged a professional marketing consultant to execute the program. All the team members have a passion for the elimination of malaria and bring the benefits to the table. We're now focusing on the fundraising aspect. Fundraising donations from corporates and ultra-high net worth individuals who can visualize the benefit of ensuring we have a malaria-free world. Citizens and companies can gain tax deductibility. We're also working on a similar incentive for donations from US citizens. Rotary International hold a convention in different cities throughout the world. In 2023, and we are organizing a congress, and we are organizing a convening of the convention, and the convening of the convention, and the congress will feature keynote speakers from around the world, emphasize scientific aspects such as vaccines, and highlighting the work. Needless to say, the title of the congress naturally will be "Finish the Fight." And next year, the convention is in Houston, and we are assisting in planning events to promote malaria is preventable and treatable. Malaria is Finish the Fight platform for the Western Pacific, aimed at dramatically reversing the trend where the incidence of malaria have increased, and to support the success of the 3-year state Vanuatu malaria-free. Now, funding for the program is aimed at intervention methods that include long-lasting insecticide wars, rapid testing devices, and spraying areas, and the need to support community health workers. And these workers are critical to the management, recording, and contact administration to guide mitigation. COVID-19, of course, has had a dramatic effect on their operational capabilities. Community health workers need greater support to enable them to be effective in the Finish the Fight. Will be successful in raising our aspirational target, alleviate poverty, and empowering the communities for a better life. But let's not forget that a child dies in the world of malaria every 2 minutes. Thank you.
Dai, thank you so much for sharing with us what Finish the Fight is working towards, and ending with that harrowing statistic. Concordia every year hosts what we call the P3 Impact Award, which recognizes excellence in public-private partnerships. And a recipient of the 2019 award did so because it demonstrated such pre-competitive alignment between different companies working together in an anti-malaria prevention space. And so working on that community health worker empowerment, the spraying, we've seen that this is a space where industry peers and competitors can come together because it's truly in their best interest, right, to work with the community. So I would love to just ask, Dai, as you think through and link back to what Deepali was sharing around this vaccine, does that change or shift in any way how Finish the Fight is orienting itself in the countries it's operating in?
Let me just say about vaccines. I think the first thing is that basically, like COVID-19, there have been 3 or There's the one from the UK. There's the one that's being developed on the Gold Coast. With access to vital good, which and we need at this point just to make sure that we're still helping those in the dire straits rural area to get them out of that situation. In some ways, one might call the vaccine the magic bullet, but it's a long way off yet before we get that magic bullet, and we're basically elimination of that area. But in the meantime, we need to keep up these intervention processes.
That's so true, and I think really reminds us all that just because there's one tool in the toolbox, we can't afford to let up on the other important steps that are part of this global effort. Well, Dai, thank you so much for sharing with us about Finish the Fight. I know that on Concordia's website, we'll be promoting more about what the Global Fund is doing in this area. So interested parties can always come back and learn more or reach out to Concordia at any time. We are also adjusting our agenda a little bit, and so we'll include remarks from Jose Manuel Barroso, Chair of GABI, at a later point. But what we want to do right now is get right into our next conversation.